So our first speaker today is from Accentcare Hospice, Natalie Kulka, and she's going to talk about musical therapy and legacy work in the end of life. Then we have Dana Beatty from the VA services again. So caregiver support services for veterans caregivers. And then we have 11 o'clock, we have Arlene Grasso, Lori Collins, and Jane Merlin. Prevent the fall, prevent the call, a caregiver's guide to fall prevention. And then we have Nancy Burrs with Mindful Motion and Adaptive Equipment Corner, once again, with some good things they're going to have to show us today. So, Kurt, are we ready? Okie dokie.
Hello, everyone. Can you hear me?
Yes. Good morning, my friend. How are you today?
Good morning. Good. How are you?
Fabulous. Fabulous. I'm so glad that you're with us today, and I just love this topic. It means so much to me.
Thank you.
So
I'm excited to share.
All right. So first, tell our listeners a little bit about yourself. I'm going to get off the screen and turn it over to you.
Okay. Let me just figure out how to share my screen here.
Okay.
It says host disabled participant screen sharing.
Oh, he said 1 second. He's going to push the button. Okay.
Okay, perfect.
Yay.
All right. You can see my presentation?
Yeah.
Perfect.
Perfect.
Awesome. All right. Good morning, everyone. My name is Natalie Kulka, and I'm a board-certified music therapist. I currently work for Accentcare Hospice, and I'm here to talk about music therapy, as well as some of the legacy projects that we implement in end of life. So first of all, I want to talk about what is and isn't music therapy. So think about, is a chaplain singing hymns at bedside music therapy? Second to think about that one. What about a hospice aide playing music in the background while providing care? Do you consider this music therapy? And then lastly, a choir singing at a patient's bedside. Someone said yes in the chat.
Yeah. Someone else just texted me and said, it's all music therapy, but if you can get a choir by your bedside, you're pretty lucky.
Well, actually, none of the above options were music therapy. Okay. So music therapy must be provided by a board-certified music therapist. The examples I just listed are all therapeutic uses of music, but they are not music therapy. They're what we call music in therapy or music at the bedside versus music as the therapy. So in this case, a chaplain and a hospice aide and a nurse, they're all providing other services, which are therapeutic with music in the background. And then I will share a little video here to start off.
My daughter needed a photographer for her wedding. And my girlfriend knew Robert for years, and she said, oh, he's a professional photographer. So he came over, and we decided that we would hire him. So after we hired him, while we was at the wedding, he wanted to dance with the mother of the bride. So see, he got his photography equipment hanging on his. Then a year later, we got married. So So it must have worked.
Right. Persistence.
Yes, it paid off. He was busy at church. He was a steward at church. Oh, he was just so busy doing so many different things. But we did like to go dance. He belonged to a fraternity. He just enjoyed being around people. He liked people. He liked to attend parties, and he liked church. So I said, well, I might be able to make it with this man. So it worked out. We've been together for 33 years. Yeah.
His home health aide actually would sing with him while she was providing care, so she just told me one morning, you know, I really think that the Gregg family would appreciate music therapy. Hi, Mr. Gregg.
How are you?
I'm great. How are you doing?
I'm doing good. All right.
Oh, I'm so glad.
Yeah, when service started coming, I didn't realize how it was going to work, you know, because I know he liked music. And when she came in with the guitar, and when she started playing, he was just excited, and he was moving his shoulders and moving his toes, and I don't know, it just made me feel so good that it made him feel good, you know.
Music therapy is really beneficial in hospice care because it can soothe pain, it can decrease anxiety, decrease restlessness. Music bridges a gap between their reality and our reality. And for families who may have not seen their loved ones speak or sing or anything in the past few years, it's just absolutely priceless.
Mrs. Gregg told me at my last visit that he's always been the life of the party. Like, he just loves music, loves dancing. He just always bringing smiles to his friends and his family.
We both like all type of music, jazz and smooth jazz and Motown. Motown is one of my favorites. and we just enjoy that kind of thing.
When it's cold.
I got my girls right here.
Yeah, you do, Mr. Gregg.
So Sarah has really helped all of us. Yes.
That was good, Mr. Gregg.
Thank you.
You're welcome. I can see clearly now the pain is gone. All of the bad feelings have disappeared. Here are the rainbows I've been waiting on. It's gonna be a bright, bright, sunshiny day.
All right, so that was just a little intro to music therapy. See if I can make this full screen again. All right, so music therapy is defined by the American Music Therapy Association as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who's completed an approved music therapy program. So a couple things I want to point out here are individualized goals. The music therapist, just as a social worker would, we are assessing goals and needs of the patient. And we are also making change happen through that therapeutic relationship. Rapport is super important for a music therapist to build with the patient. Music therapists address physical, emotional, cognitive, and social needs of individuals. And music interventions can promote wellness, manage stress, pain, be a means of emotional expression, enhance memory, especially in patients with dementia, improve communication, and promote physical rehabilitation. And this is an evidence-based practice. So music therapy has been around for a long time, actually, since World War II. There were the first music therapists who worked with World War II soldiers to manage symptoms of PTSD. A music therapist has a lot of education before they get the title MTBC. So you must go through 4 years of school or hold a bachelor's degree from an approved college. I went to Loyola University New Orleans. Music therapists take classes in musical foundations, so that includes guitar and piano lessons, as well as voice. Those are the 3 main instruments that are regulated in our education. But of course, you can be a music therapist who plays flute or harp or any other primary instrument of your choosing. We also take classes in clinical foundations. So psychology classes, neuroscience, really understanding how the brain works and processes music. And then lastly, we take music therapy classes, which put all of that knowledge kind of together and learn specific music therapy interventions to target goals of the patient. After schooling, a music therapist completes 1,200 hours or 6 months of a clinical internship. Mine was completed at Baton Rouge General Medical Center in Louisiana. So I worked with a wide variety of populations, including oncology patients, mental health, as well as even children in the burn unit. So it was a very diverse opportunity. And then the music therapist lastly passes the board certification exam. So this is regulated by the Certification Board for Music Therapists, and just, assures that the music therapist has the appropriate training and background to get that credential. And then just like other clinical professions, we do recertify every 5 years. So next I'm going to discuss how music therapy targets specific goals. So music therapy can lead to a reduction in perceived pain, decreased anxiety and increased relaxation, increased energy, increased quality of life, sense of spiritual support, and most importantly, music therapists are one additional person who is spending time at the bedside. So in end of life, that is one of the number one things that we try to emphasize is just our amount of time that we are spending with that patient and caring for their needs at the bedside. So these are some of the areas where we may see room for improvement with the patient. Always want to minimize pain in hospice care. Always want to keep the patient comfortable, along with improving quality of life, decreasing restlessness. Music therapists also assess needs of the caregiver. So this being the caregiving conference, this is definitely a focus of ours as well. We really want to care for the emotional needs of the caregiver, because if the caregiver is not taken care of, the patient certainly is not taken care of.
Natalie, when my husband was on hospice with Seasons at the time, one of the things that made me feel so good as a caregiver is when the nurse came in to check him and to check his vitals and his blood, she said, "I need to check yours too, Linda. I need to take care of you." But I can't tell you how comforting that was.
Yes. Yeah, and we have respite as part of hospice care too, which is where the caregiver, I believe it's 5 days a month, the caregiver can put the patient in a facility to just get a break and relieve some of that caregiver burnout. So that's definitely a focus of music therapists, always to assess the needs of the caregiver as well. After time of death, music therapists play a role in bereavement support. So at Seasons or Accentcare Hospice, music therapists are part of that bereavement team. And then lastly, music therapists provide procedural support for extubations. Now I will discuss some of these specific research evidence-based interventions. Music therapists will assess those needs or goals that I showed on the previous slide, and then match them to an intervention that is proven to target one of those needs. So the first intervention I want to talk about is music-prompted reminiscence. This is highly beneficial to improve quality of life and mood in pretty much any patient at the bedside. However, especially for those patients with dementia, music can trigger some memories that may not have been as easily recalled without music. One specific method is called the soundtrack of my life, or a life review playlist. So this is when a music therapist asks a patient or a family to identify a song from each period of that person's life. So it could be by decade, it could be by significant life events. So for example, I might build a playlist with a song that a person's parents sang to them when they were a baby. I might add a song from their teenage years, a song that brings them joy that they used to dance to. Then maybe a wedding song, or their children's wedding song, songs that mean something, that are attached to specific memories. So in a sense, this life review playlist is a musical biography. And that really allows for reflection and increased acceptance of end of life. Active music making or improvisation is another method we use. So for those patients who are physically able and maybe are musicians as well, they can certainly play along with us within music therapy sessions. For example, I have one patient who currently has lung cancer and has a really difficult time expressing his emotions to his spouse, expressing his emotions to the social worker and our team in general. However, he was in a band in his youth, so he plays electric guitar. And in our sessions, we play songs that he selects, and then he explains to me why they're important to him, what kind of feelings come up. And through musical improvisation, he can express some of those emotions without words. Music therapists utilize relaxation techniques. So many of you might be familiar with the term progressive muscle relaxation. This is widely used across clinical professions. However, the benefit of having a music therapist implement progressive muscle relaxation is that we can provide live music paired with tensing and releasing of each muscle in the body. So that live music is actually proven to be more beneficial and implement more change than recorded music. We utilize the ISO principle. So this can be used to either relax the patient or improve their mood. ISO principle is meeting that patient where they are at. So if someone is super anxious when I walk in the room, they might have a higher heart rate, they might be breathing really rapidly. So what I would do is play music that matches their breathing, even if it's sort of fast to start off with, and then slowly slow that music down, maybe even change the song or the rhythmic structure. And that can actually physically lower a patient's heartbeat and their breathing pattern. So music really provides that rhythmic structure for some of those body's responses. Songwriting is another useful method. Patients who want to express love for their friends or family sometimes choose to write songs with us. It's also a really great way to reflect on everything they've been through in their life, or maybe people they are grieving themselves. So this is a great way to reflect, and the music therapists often are trained in songwriting themselves. So even if someone has never written a song before, we know how to provide that song structure and help the patient along to maybe fill in the blank, or to even rephrase the patient's words into a song form. Similarly, lyric discussion is useful because it allows the artist to use their words to convey what the patient might be feeling. So for example, one song I often use is The Dance by Garth Brooks. If you're familiar with this song, it has a line, "I could have missed the pain, but I'd have to miss the dance." Talking about, you know, the ups and downs of life, and oftentimes at end of life, caregivers are experiencing a lot of pain, emotional pain. But this song is a reminder that there were a bunch of really wonderful moments and beautiful moments throughout that person's life too. Not every caregiver is going to be feeling this way, but this is just an example of maybe using lyrics to describe how you are feeling and you can't necessarily find the words yourself. And then lastly, music therapists help with legacy projects. So I'll talk about some of our legacy projects at Accentcare a little bit later. But one that I do want to mention is the heartbeat recording. This is widely used across the profession. Music therapists can get a stethoscope that actually records the heartbeat. We then transfer that to a computer and edit it so that it's clear for the family to hear. And also we can add the patient's favorite song over it, whether it's recorded or the music therapist plays it live. We can make that heartbeat kind of the bass in the background. So that's a really nice touch for the family. One of the differences between someone just playing music at the bedside and an actual music therapist is music therapists are trained in cultural awareness and using culturally appropriate music. So we really emphasize using patient-preferred music first and foremost, because that is the music that the patient connects with. They may find a song that they've never heard before relaxing, but it may not trigger memories and target some of those other goals I mentioned earlier. Also, there are several elements of music which are cultural in themselves. This includes tonality, rhythm, the instruments used, and associations or memberships of certain groups with that specific type of music. We also want to make sure, even if we're unfamiliar with a certain culture or background of the patient, we want to educate ourselves to the appropriate uses of the songs that we are using. So for example, I wouldn't play maybe a song used at a Catholic baptism for end of life. You know, that's just an example, but I want to make sure I'm using songs that are appropriate to end of life. Next, I'll discuss a little bit of the theory behind how music changes pain perception. So the gate control theory of pain proposes that there is a neural gate present in the spinal cord. This can open and close, thereby modulating the person's perception of their pain. So several psychological factors do play a role in the perception of pain, and music is actually one of these stimuli that can close this neural gate. So we want to remember that pain perception is subjective, not objective. So when we ask patients to rate pain on a scale of 0 to 10, a 4 may not be the same for every patient, right? A 4 is not objective. We don't know exactly what that feels like. We only know that that is that patient's experience of a 4. Additionally, using a cognitive behavioral model of pain management, when music is repeatedly paired with this deep breathing, slowed heart rate, slower breathing, over time, music alone will cue that body response. So just like anything else, when you practice that music relaxation repeatedly, eventually the music alone will allow the body to relax, even sometimes without a therapist present. Another goal is to direct that attention away from the patient's pain or anxiety. Again, provide a musical stimulus for rhythmic breathing, and cue some visual positive imagery. We always want to focus on positive reminiscence, unless we are, processing something traumatic that a patient has experienced in their life. We really try to cue those positive images with relaxation. Research indicates that hospice patients who experience music therapy do report an overall increase in quality of life. Improving mood and exploring the meaning of life through lyric analysis and reminiscence can also lead to increased acceptance of end of life. This is a time where people really reflect, at end of life. They reflect on the choices they've made, they reflect on their experiences, and music is one of the ways to process that. Especially for our nonverbal patients, music is a form of interpersonal interaction. So I may be someone who is nonverbal and not able to communicate always. However, I can tap to the rhythm, or I can remember lyrics, because music lyrics are stored in a different part of the brain than conversational speech. Music therapy also helps patients continue that spiritual tradition. Patients may no longer be able to participate in religious rituals such as going to church or engaging in prayer so many times a day when they are bedbound. So music therapists can work closely with our chaplains and help the patient to still feel some sense of spiritual well-being. Some of you may recognize this man on the left, or on the right here. This is a video that actually went viral probably 10 plus years ago. But this is a elderly man with dementia who puts on headphones, listens to one of the favorite songs from his youth, and really comes alive, really animates when he hears that song. So now, like we discussed at the beginning of the session, this is not music therapy, because this is just someone giving him headphones with a recorded song, but it still is a great example of how music can prompt memories. Again, we want to use patient-preferred music, and people can remember song lyrics when they are no longer able to converse. This is especially important for those families that are looking for a way to connect with a loved one in a way that they maybe aren't used to before. At Accentcare Hospice, we are associated with We Honor Veterans. So I am part of, sorry for the lawnmower in the background. I am part of a pinning ceremony So music therapists, along with a social worker or chaplain or nurse, will all come to the patient's bedside if they are a veteran and honor them through a ceremony. So we'll give them a pin, a certificate, sing some patriotic songs, and just show our appreciation for them being a veteran. This is also a very important or significant time for the family. Additionally, we do nightingale pinnings. So this is kind of a similar ceremony, but for when a patient was a nurse. And then we do it for first responders as well. Just making sure we honor and appreciate what that patient has experienced and done for others throughout their life. Now moving on to after the time of death. As I mentioned earlier, music therapists at Accentcare do play a role in bereavement and grief management. So because music is processed in the limbic system, it contributes to emotional expression and processing, as well as those long-term memories, like I mentioned. So some of those same interventions that we use at the bedside can also be beneficial in bereavement. We do one-on-one individual bereavement visits as well as group sessions. And for our young kids who have experienced loss, we do a camp once a year. We actually just held it for our Pinellas and Tampa site in November. And this is called Camp Kangaroo. This is for children aged 5 to 13 who have experienced the loss of a loved one. Using a psychotherapy and creative arts approach, we help children to acknowledge their feelings, notice how grief feels in the body, and really normalize talking about that grief, especially with others who have experienced similar losses. And then I will show a little video here to show you about Camp Kangaroo.
So I'll sing the chorus and then you guys can like sing it back to me. I figured we could sing the chorus maybe twice with the kids.
Okay. Yeah, because I think today is mainly just chorus.
Yeah.
So let's focus on that.
Rehearsing the camp song, which is something that we do every year at Camp Kangaroo with the kids. And so we usually write a melody beforehand, and then the kids come up with the words, and then we figure out how to put those words into nice lyrics for the song.
We're expressing our feelings. Remembering the ones we love.
And we learn new things.
We're learning new things. What type of new things? We create lyrics for the song based on the words. We kind of put them together in order that makes sense for what they're expressing, what they're learning about. So we'll have a chorus that's just about, we usually ask them about the whole camp experience, and then verse 1 might be about emotions, loneliness. Other emotions?
Sad.
Verse 2 might be about what they're doing, what they've learned to cope with those emotions. But again, it's really based on what the kids tell us. It's really driven by them.
Guilt.
Sometimes it might not be art that captures one, but it may be the music. It may be the journaling. It may be painting. It may be talking with others in a smaller group setting. So there's so many different activities and there's so many different ways in which they can connect.
We are Camp Kangaroo for our special ones, trying to feel better now, dealing with our grief, and lonely.
So we do hold Camp Kangaroo, I believe at every site throughout the nation as part of Accentcare Hospice. Like you saw in that video, they use songwriting to express the physicality of grief. A drum circle is often used as well. Songwriting can reinforce the skills that children learned in group that day. So we do talk about grief and do art therapy interventions, but songwriting can be a way for those skills that the kids learn that day to kind of stick with them a little more. And then lastly, I wanted to talk about some of the legacy projects that we do at Accentcare. So on the left, you will see you'll see some memory bears. These are made by a patient's friend or family member giving us pieces of their clothing that they would like turned into these little bears. And then on the right, that teddy bear can actually have that heartbeat recording that I mentioned earlier put inside of it. So in our site, we recently started making the memory bears with the patient's clothing and additionally putting the heartbeat inside, which is really special. Also on the right, you'll see a recordable storybook. So this is a legacy project that we do sometimes with patients who may have young kids or grandkids, and they can actually record themselves reading each page of the story so that even after they've passed, they can still read a story to the little ones in their life. On the left here is a hand mold. This is when the patient and a friend or family member holds hands, and then we put that in the plaster mold. So this is a great keepsake. We use that pretty often.
I have that of my husband's hand with my granddaughter, which is absolutely fabulous. And my bear is sitting right next to me now.
Oh, that's so special. I love when really anyone can do this as part of the care team, nurses included, can implement legacy projects. But music therapists and social workers do play a huge role in legacy projects. And then on the right, we have some framed photos of people holding hands that they gifted to the family. And then on the bottom right are fingerprint necklaces or keychains. So this is just when we stamp the fingerprint and turn that into a little keepsake. So I just shared a lot of information, but all of this research, it proves that music therapy is beneficial at the bedside, and music therapists are just, again, one of the members of the care team that increase that one-on-one interaction at the bedside, which is so important. So Accentcare Hospice is the largest employer of music therapists in the world. They really appreciate the additional element of humanity and how music therapists help to care for the whole person as well as the bereaved after the time of death. So thank you so much for having me. You can refer a loved one or patient to hospice through that website. And then I will answer any questions.
I had somebody send in a question. Well, not a question, actually a comment. And
okay.
She said that when she worked with Accentcare, the care that she was given, her father was given, was absolutely fabulous. And the legacy projects continue, she says, to affect me every day.
Oh.
So I thought that was very kind.
Yeah,
so thank you. Go ahead.
Well, just thank you. That's our ultimate goal, is for not only the patient but the caregiver to feel cared for and honored and just seen as a whole person. We we try to see the humanity in every single person that we interact with at the bedside.
Well, I think it's very important, not just at end of life, but all of life, that we spend
Absolutely.
time with each other, that we speak with each other, that we hold hands. Because caregivers, excuse me, caregivers and when it gets to be, that caregiving experience is exhausting. Sometimes they're just so focused on the medicine or eating or whatever that we're missing that precious time with our loved one. So I just want everybody to reconsider that because it's really important. That's what people really want is attention.
Yeah, our goal is to relieve some of that caregiver stress so that they can really appreciate the time with the loved one and grieve in the way that everyone should be able to.
Yeah, excuse me, my tea just went down the wrong way. Thank you, Natalie, for being with us today. Thank you to Accentcare for everything they do for our community. I'm on the board of Accentcare, actually. I'm very proud to be. Very proud to be part of it. So hope to see you soon, my friend.
Thank you. Thanks so much for having me.
Have a delicious day.
You as well. Thanks.